Hi, I'm Talia and I'll be doing an instructional video on cryotherapy. I have chosen to treat a patient with an acute lateral ankle sprain using controlled cold compression. Some contraindications to cryotherapy would be if the patient had cold hypersensitivity or intolerance, so they would have either a skin reaction to cold or extreme pain with cold. They might have cryoglobulinemia or paroxysmal cold hemoglobinuria, which would be blood in the urine after exposure to cold. If they had Raynaud's disease, which would be they would have extremely white and cold distal extremities like the fingers and toes. If they had overgenerating peripheral nerves like Guillain-Barré, or if they had peripheral vascular disease or circulatory compromise like that would exist with diabetes. And then extreme caution would need to be taken with patients when you wanted to treat over a superficial nerve like peroneal nerve or ulnar nerve. If you were treating a patient over an open wound, or if they had hypertension, if they had poor sensation at the skin, or if they were very young or very old patients because they would have poor thermoregulation. So next I will show you the game ready. This is a modality used for controlled cold compression. First you would fill this container with ice and water, and then you would close it. And then you would turn it on, as so. The Cameron text recommends that you use 15 minutes of therapy every 2 hours and that you keep the temperature between 50 and 59 degrees, as we have shown here. And today we'll be using medium compression for the ankle sprain. And then next I'll show you how to put on the ankle cuff on my patient. We have our patient supine with her leg elevated. And for her ankle, we would just put it like this. And then first, before using any cryotherapy, we would assess the patient's skin for temperature, color, and sensation. So she's going to be a little warm because she's swollen, but we would only be concerned if the patient had cold skin, because then it would mean that they would probably have poor circulation to the area. Her color is good, and also, ma'am, can you tell me when you feel anything when I'm touching you? Yes. Good. She has good sensation. So we're good to go. So first I'm going to wrap her up with this cuff, as so. Cold compression therapy, controlled cold compression therapy is good because it offers the benefits of cryotherapy as well as compression, so it will address her pain and her edema. So like this. And then when I turn the machine on, the water will rush into this cuff and fill it up and then create compression and then relaxation, compression, relaxation. So I'm going to start it. And then it's filling up with water. Do you feel cold?
Yes.
Fabulous. That concludes my video.